behavioral schemata that, what would imagine trying to come up with how you think you should be acting masculine when you haven't had a masculine role model to either tell you to act that's too much or that's too little, you know what I mean? And help you course correct through life. But there's also, you just having two parents in the house doesn't usually predict a good outcome. Just because there's two parents, there could be a lot. We always look at the adverse childhood event scores. Whereas violence, anybody go to jail, food insecurity, clothing insecurity, all of those things we take into account. Like Maslow's hierarchy of needs. But when it comes to addiction and mental health, it's the subtler absence of certain things, especially when other needs are being met in a young child, that when they're an adult, how do they self-soothe? What's available to them? What's acceptable in like making cannabis legal? Great, it's a great progressive thought and idea, but once you make that available, then it gets entered into the country's zeitgeist, and then it becomes an acceptable. Obviously, you have you been to Vegas? Like the weed that's just going around casinos?
No,
I was shocked.
Yeah.
Yeah.
Well, I'm in Vegas. I haven't smelled that much
Crazy.
weed, but I do. I just know it's like you said. Once it's become legal,
it's acceptable, man.
Yeah.
I mean, it's just and yeah, that there's positivity to that, because Just Say No didn't work, obviously, and Mothers Against Drunk Driving didn't work. We know that for a fact. But what's the opposite of that? I mean, you don't want to be too. They're finding that needle exchange programs are just.
Yeah.
Corruption behind those, and it's. I don't want to get into the politics of it. But
before we move on, because I want to go to some hot takes, and I want to talk more about in the scope that we were talking about earlier. But I just want to say, it's fascinating to me. I have a woman that is going to come on the podcast. She's a eating disorder specialist provider, because I just don't think we've really, that's a whole other topic. His eating disorders really do fascinate me a lot. Not in any great way. It's one of the most tragic things I've ever seen is eating disorders. I mean, it's one of the most mind-baffling things.
It's up there with
as
heavy
a provider,
addictions.
Well, that's what I was going to say.
Way up there.
With providers, I've spoken about this on the pod before. Out of all the doctors that I've talked to or spoken to, it is the one thing we know the least about, right? As far as treating it, right? And I've seen in a lot of people in my life who've worked 12 steps with that and has had success because it's a spiritual thing, right? It's a spiritual experience that's needed for that person to start on a new, and so just like with us addicts, I have my own personal opinion, right? I really don't believe if you're an addict or an alcoholic, I really don't believe there is a treatment center that will fix it. I don't think it all comes down to the patient or the person, the individual, what they're doing, and developing new esteemable acts, working through a spiritual process, doing an inventory. Those are all things that I think are required for an alcoholic to have long-term sobriety, like myself.
I agree.
I've seen other people find yoga, other spiritual practices. I'm sure that there has been a couple people who've done ayahuasca and had some crazy mind-opening thing. I'm not going to debunk that. That's their experience. But for me, working with so many people over the years, the only thing that I've seen work consistently is spiritual work within a 12-step program, because it's good, it's healthy for all of us humans. Any human could benefit from it, but to get out of that vicious cycle, I need a rude awakening, I need a sober thought, and I need direction. And I have to have willingness to do things differently, to experience things that are new, that are healthy for me, to believe, right? The faith without works is dead, right? I need to really live it, breathe it, experience it, to be like, oh, I can live a life happy, joyous, and free with alcohol and drugs. And that's the thing that people have a hard time getting to. So,
and the patience to sit still until the shit happens.
Yeah, hold on to your seat for dear life.
Do not leave until the magic happens. Is the reason why we say that in the meetings. You don't leave until because the magic will. It happens to everybody who stick around long enough. Isn't that amazing?
Yeah.
That's one thing that I've never seen anybody go, oh, fuck this, after 12 years of sobriety. I mean, unless they really are done, and then they walk out.
And I don't want to beat a dead horse here, but I want to say one more thing about eating disorders. Something about that particular thing. There was a client I was trying to help one time, And I mean, there's been many of them when I was doing work in other programs and stuff like that. But the trauma that they experienced as a child came down from because they wanted a desperate need to control one thing. And it comforted them to have that control of that one thing. And the only thing that I can think of in my I'm not a doctor and I'm not a therapist and I'm not a licensed provider, but seeing so much of this, it's like there has to be something there in the developmental years for these kids, these adults, when they, because the one necessity that we have as humans is to drink and eat water, or sorry, to drink water and to eat food, to live. And these people will literally starve themselves to death. And they've gone through treatment, they've had attention, they have had trauma, they've had trauma work, they've done trauma therapy. I mean, they have had all these things, and they still struggle with it. And they go through treatment, and it's just it's something so. And I don't think it's genetic. It's something.
I don't honestly. That's not my specialty.
I know. I'm not trying to talk.
I'm intrigued by it.
It's something that just really, yeah.
It pisses me off when my patients have because I don't know.
But don't you think that's how providers feel about it?
They
all have
I
to
totally
feel about
agree
that.
with you. It's like people with sex love and sex love addiction and intimacy disorders. It's like fucking.
What do you do?
Fucking is so natural. Eating is, I mean, propagation of species and survival with food and water.
Yeah.
It's like going on a sleep strike. It's like, I'm not sleeping ever again. It's like, dude, talk about hierarchy of needs. Sex, food, water, shelter.
Yeah.
I mean,
it's crazy. So not crazy. It's very baffling, and it's a high concern. I always praise and thank the people who dedicate their life to really trying to work that, because we had a lot of people before us with the whole alcohol abuse and the drug. We had a lot of test runs with people where they figured out, and they did find out there is a solution. And I'm grateful that we found it. Truly, and I think there is, and for anyone out there who's struggling with this, I'm not the person, and Dr. Joe says he's not the person. But if that is you who are out there struggling with something like that, I do know of some great resources of people. There's studies going on. There are programs, hospitals, places that if you are one of those people struggling with an eating disorder, I'm going to have a guest on here in just a couple months from now who does specialize in that, and I will be asking her all the questions then. But I love, since we do have Dr. Joe here, I wanted to hear his take on that. Moving on, I have a couple hot takes for you. Okay? All right. So these are going to be kind of quick questions I ask you, and you got to answer really, really fast. Okay?
I can't do that, but go ahead.
Okay. All right. You
will.
ready?
I will try.
We're going to start off with your scope of practice. Okay? Levels of care, residential or outpatient? Do you prefer?
Residential.
Okay. Cocaine addicts or meth addicts?
Cocaine addicts.
Okay. Sorry. But something I do want to talk about is that your last 14 years, you said you've been in
13,
addiction medicine.
Addiction medicine. I mean, officially, I was able to prescribe. I was one of the first prescribers of buprenorphine in 2008, I think.
Okay.
So I was onto MAT, but I was abstinence only, man. I used to write articles on the devil of that is methadone and buprenorphine.
Okay.
Until I started visiting the East Coast.
That's my guy.
And learning the numbers.
Yeah.
And you could look up old articles that I used to write for. I think it was the Fix, and I got hammered. Do you remember that? Do you remember that, babe? Oh my God! I got crucified for being an abstinence-only guy. I was like, "This is the way I got sober."
Okay, but here's the thing. This is the best topic we could talk about. Okay, I've been waiting for this topic all night to get onto this, but I kept getting sidetracked. Okay, here's the thing. Because remember, I opened up a couple clinics with a provider, Eden Wellness. It was a psychiatric, whatever. I was having a meeting, and I'll just say it. I don't have no problem saying it. Laguna Beach Treatment Hospital. Okay. I walked in there, and my provider, it was Sean. You know Sean Leonard?
Yeah.
All right, okay, great guy.
I can neither confirm nor no.
Oh yeah, you don't know.
I used to work with him.
Okay, yeah. Okay. You can't have him show up on time, but when he's there, He's great with the patients. He's awesome. Don't put that in there. Sorry.
Yeah, just cut out everything.
So
about
just
him.
cut everything
Yeah.
I ever said about Sean Leonard. Anyways, the guy that was supposed to meet me there didn't show up. So now I'm in this board meeting. I'm this tattooed drug addict in this board meeting with 12 providers at this hospital, and I was talking about how we were doing some work trying to figure out some manufacturers of the MAT programs to have proper 12, 18-month tapers for Suboxone.
Yay.
Okay, but here's the thing. I told them that this is something we were passionate about, and that one of the doctors looked at me dead in the eyes and says, well, and I don't know if they profiled me or they knew that I was also an addict. I don't know if they knew that when I was talking to them. I didn't tell them that, but he looked at me dead in the eyes. He goes, well, why would they want to come off? I said, what do you mean? Who wants to be on subs their whole life? Like,
Yeah.
or methadone. I told him, have you ever been to a methadone clinic and waited in line in the cold for methadone? Like, go ask anyone in that line if they like the life they're living, right? And he goes, well, Suboxone is probably one of the best drugs that's been created in the last 20, 30, or whatever, 20 years to treat addiction. I was like, well, that's because you did it for you, not for the addict. You created that with no way out. This is my personal opinion. This is not Dr. Joe. In my opinion, you created this with no way out to make money or to get people dependent on something that you can keep manufacturing. Because here's the thing, there is a way. I've spoken to manufacturers of medications. There is a way where you can have subs, because you taper down 0.5 or whatever milligram, whatever, but there is a way.
That's my whole practice, by the way.
Yeah, is to get them off.
I am usually referred patients who have been on it for years that have a hard time coming off that 1 milligram.
It's the worst,
There's
bro.
methodologies, but there's ways to do it.
But you're having to figure out ways to do it. That's the problem. You're having to
No,
figure out.
that's the crux of my practice. That's what
Okay,
I've
okay,
gotten
sorry.
good at over
Okay,
the
yeah,
years.
well, I know.
Yeah, I'm not going to give away my
No,
secret.
no, okay, no, don't give away your secret. But
it's person dependent. See, that's the thing. You've got to
Yeah.
get to know
Yeah, I
how
know.
a person came to you. You've got to do that history before the person gets there, and then you can go from there. And you need to do it like they say. See them every month. What's the plan this month? What's the long-term plan? Are we talking you're going to be on it for another year? And why? Get them to think about why they should come off, when they should come off. I mean,
But that's the thing is, like, I feel like providers are having to come up with a treatment plan on their own when the drug itself can remove cravings. It can help. It definitely can help with being dope sick for sure.
Oh, yeah.
But the thing is, the problem I've always had is there's no means to an end for it. From like the actual, just the textbook structure of it.
Right.
Get them on this, they won't die. And I think that to me is the biggest cop out for us addicts. It's like, I understand going to detox, comfort meds. I understand going here, maybe some transitional stuff here, but for methadone and Suboxone, for them to preach about it to be this like life-saving thing. I was in a long podcast thing with a friend of mine who is also, he just left. His name's James. He was here earlier. Great guy. He's a big Mac guy. He really believes that it's really, really effective. Okay, it's effective here now for people who are not addicts because they wanted to do something that was going to save us. And I can't tell you, I just feel like it does so much more damage to me. There's so much more damage than good because it's like they wanted to do that for themselves, not actually address the core issue. Does that make sense? We created a drug that is going to get them off the street drug, but they are now dependent even more now on this one thing. The actual withdrawals.
until they're ready to come off.
Yeah,
Absolutely.
the Suboxone is harder to come off if they've been taking it for 90 to 60, 6 months or longer. At least from my experience, coming off subs is a longer detox, right?
The higher the dose and the longer you're on, you do notice
It's like-
some changes in the
yeah.
opioid receptors that take a while for that to reverse.
Yeah.
And the longer you're on it, the longer it takes. But it's
But it's the psychological part too, because they've been sober for a while, right? And been taking it, so now it's part of them. It's not like they're high, crash landing into detox and then kicking. It's they're at work. They got a 401k now. They're living their life and they're trapped with it. So now when they go off of it, they're like they've been almost sober, basically sober minded, right? So now they're terrified to get off because they're going to go immediately dope sick, or if they taper off. Okay, when you say that you don't need to tell us, but are the prescribable amounts of the medication itself is there a prescribable amount so they do not have to go into post-acute withdrawals, or they don't go into withdrawals? Is there a certain step
Two
down?
separate things. Post-acute withdrawal is different than, yeah, okay.
Is if they're on another thing, right? Because if they're taking Suboxone and they want to get high, right? They get off of it because using on subs is super dangerous.
You're talking about precipitated withdrawal, not
Yeah.
post-acute. Okay.
Well, I'm saying like if they're getting off to get high, okay, that's what I'm saying. So which one is that?
Well,
If
I mean, if you follow Suboxone with I don't want to give anybody a direction how to do this, but if you follow Suboxone with a regular opiate, it's not precipitated withdrawal. It's the Suboxone, the buprenorphine molecule, that will
Block
bump
it.
It sits in the receptor, so it activates the receptor, and it also blocks it with a higher specificity for that receptor than another opiate that's coming along.
Okay.
So you need to use a very powerful opiate to displace it and overwhelm the amount of buprenorphine that you have on your receptors
But
already.
is there a lot of overdoses in that? Aren't there a lot of people overdosing on fentanyl because they're on subs?
You can
They're getting off-
overdose because you don't realize how high you're
yeah,
getting
because
from
you're not
the
getting
fentanyl
high.
until it hits your brainstem and you stop breathing.
That's what
and
I'm
then
saying.
by then it's too late. Okay, that's what you're
That's
talking about?
yeah. I'm just trying.
Yes,
yeah.
you're at risk of that.
Okay, people coming off of it, or people who stop taking it for a day or two. Now they're in withdrawals, or they're feeling very uncomfortable, so they go get high. They can't get high that they used to, because when we get clean sober, the most common thing, even on no meds, no subs, we go out, use the same amount we always did, we overdose and die. That's a very common overdose.
Tolerance, yeah.
But what I'm saying is, with the subs, because they get trapped in it, I say trapped because it really feels like that for addicts. I feel like they get on this medication, they have to keep their insurance current, and it being, I know Medi-Cal and Cosmo does cover it with a provider. Are we good? Yeah. We're good? All right. We're gonna do like 3 more things, we'll close up. But I love talking to business because I just feel like it was made to be a trap and not to be helpful. That's all I'm saying.
I'll give you my own personal experience.
Okay.
So everybody that comes into my practice, we develop a plan, or at least a thought of a plan, and we reiterate it every time they come in, which is monthly. So I run a really strict program. You pop positive more than once on something, you leave until you come back testing negative for any other substances, especially illicit substances.
Yeah.
When I was in treatment, I was taking massive amounts of opiates before I came in, and the withdrawal I was going through was incredible. And I was prescribed Subutex because they didn't even have Suboxone back then. And the relief I experienced was so sudden and intense and so relieving and then euphoric that I developed a respect for that medication the minute I took it myself. And I said, nah, this is not good. If something can make me feel like everything was all of a sudden better, and it wasn't better. I came in like you, man. I came in, everything burned to the ground. Everything ripped away from me in one day. And then a pill that replaced what I was just taking 4 or 5 days later when I was in fulminant withdrawal and under my tongue, and I was Mr. Saturday Night again. I felt like I was the same bullshit artist that I was before I came in. And I went, this is not what I'm looking for. I was on 2 days of it, refused it after that, and I've been abstinent since then. It's
Okay, so here's
that's
the
why
thing.
I was an abstinence book thumper from Jump Street in the beginning.
My point. So I have a point with that. I love what you just said, because let's say that I went to go get my appendix taken out, right, a week ago. All right, I was all excited because this is my free lapse, right? Because I'm like, okay, I'm gonna get put under. I get to go get loaded for like a day. This is gonna be awesome. Well, I went
That's
in
what
there.
I say during my colonoscopies. I say, give the fentanyl first.
Okay.
But they don't even use fentanyl anymore. It's
No.
all propofol.
Okay, no, hear me out. I was
funny.
so disappointed. I get in there, they're got me prepped. I was like, all right, guys, what are we working with? I've done everything, The only thing I haven't done is fentanyl.
You expected
because
the menu, the
when I use
anesthesiologist
opiates,
to show you the menu?
all the kids have been talking about fentanyl for like a decade, right?
Yeah.
And I got all
Don't want
excited.
to know about it.
Well, I got all excited because maybe I get to do fentanyl for the first time. This is gonna be awesome. He goes, I'm actually gonna give you methadone. I was like, he gave me methadone. That's what he gave me for pain.
That's incredible. I would never think that pre-operatively or after you had the surgery.
Like right when I went in there, he's like, I'm gonna knock you out. I'm gonna give you methadone. And I was like, I feel like I was like in some terrible nightmare. I was like, again, methadone. I feel like I'm in full circle. I told them all as a drug addict. I was like, you're gonna give me methadone? I was like, why can't I get any like morphine or fentanyl or whatever? And I was like, but then I was like, that's me, dude. That's the drug addict just making demands in there. But anyways, but here's the thing. They didn't give me methadone after. They gave it to me for that thing.
Yeah, it's long acting.
detox,
That's
right?
actually brilliant. I'm thinking.
Okay, so-
that's what a great idea.
Okay, so but here's the thing.
Fentanyl lasts a half an hour. Methadone lasts 2 days.
Exactly. So here's my point. For us drug addicts and alcoholics coming in to detox, they're 90%. I'm not gonna say numbers because I don't know the numbers on this specific thing, but people get on Suboxone and keep taking it after. You just told me a story of how you came in feeling like hell, and a doctor prescribed you Suboxone, and you were able
Doctor
to actually
saved my life, by the way.
exactly
Yeah.
right. Which
Yeah.
I think that is
my
a
life.
great effort forward, right? But the issue is there's no planned exit for the Suboxone, so they're stuck in it. Most doctors aren't like you.
There is. Oh, okay.
That's what I'm trying to say. Most doctors aren't like you. That's my whole point of bringing this up. That's the issue for me.
Again, giving away my trade secrets.
Okay. No.
It's not a secret. You just have to be in tune with the patient and let them know what the game plan's going to be.
But
And
then
are
there's
you
no-
signing off from
But
Jump
most, I'm telling you,
There's
Dr.
not.
Joe, these doctors out here don't have a game plan for them. They they slap them on the subs, they leave, and they have to fill their prescription for years after that because they're hooked on. They're so reliant on it. And I think for us addicts, being
Mm-hmm.
binded to something like that cuts us off spiritually. That's what I believe. When we're so heavily reliant on this thing, and you know,
I could understand
you know,
that. Yeah,
that's
no,
the part
I
that
get it.
and it's not something that I think that is something that shame addicts for being on because it's a huge topic, right? Because there's people in recovery say if you're on Suboxone and you're not actually sober, I'm not that guy. I'm just saying that like I've seen people in recovery years down the road who literally it is the most devastating thing they struggle with is like I cannot get off of this thing. And there's not providers out there enough who are like you, right? Who are capable, knowledgeable, or even have the intention to give them a plan out of it. And it's for methadone too.
Intention. It's so interesting you said that.
Yeah,
It's what kind of practice do they have? Do they need to fill their waiting
I'm
room
telling you,
with
bro.
as many people as possible? And do they charge them all cash? It
reminds me-
exorbitant amounts of money.
It's like the implants, bro. We don't even go into the implants fucking thing. We've talked about that on Instagram. It blew up. Leo was talking about because I lived through that heyday. And luckily, Dr. Joe is a real one. Okay, he ain't one of those cattle farmers for drug addicts.
No,
okay?
I actually, you could look up, I was a witness for the prosecution for when those pellet docs were going to jail
Yeah,
or losing their licenses.
totally. Yeah, yeah. So it's just like one of those things. Is I feel like that whole approach, you know, it just gets me. I just want to advocate because I see so many clients that have come into my program. I've seen clients I've seen other brothers and sisters in recovery. It is just like, it's like this silent struggle, you know? And I just feel like the way that they created it was meant to keep them on it, just like methadone. And the way that the way that that's set up is a fucking nightmare, and I think it's totally bullshit.
You're right. It's a fucking nightmare.
Fucking pissed about it, dude.
And also,
Right?
and also the milieu that we have set up for our patients once they get out of treatment to go to pharmacies and
Yeah.
the pharmacists that I'm gonna come right out and say this because this is something that is beyond me, but I can understand the fatigue in the pharmacy system and the fear that they have of being labeled by the DEA as I don't know what they're worried about. I have no idea. But the shame that they put some of my patients through for going for their monthly prescriptions when nothing is out of line, nothing's aberrant, everything is, and the way they make them feel is that I try to prepare patients for that. I try to prepare patients for
I know that you do.
the
Yeah.
potential shame. I'm sorry if I'm going on. If we have to.
No, you're good. No, I know you
But
do.
this is super important. That,
It is, yeah.
That they come in with their sponsors telling them they got to get off this shit. Really.
Yeah.
And I can't go to AA because I feel like I'm dirty what?
Yeah.
Dirty?
Well, it's the thing. Then I'm dirty then because I went and got my appendix taken out. I took a medication, and so now I have 9 days clean rather than
What's
nine.
your
It's
intention?
ridiculous.
Dude,
we
I
know.
wouldn't
We
even
know
do
though.
so.
Like, especially in the
But
the
your
book, it talks
sobriety is
about
your
that.
own, man. Your recovery is your own.
Exactly.
Whether you want to say you got 9 days or 9 years.
Exactly. But that's the thing though, is that I think you really made a good point, because whatever each individual addict and alcoholic who's struggling, they need to know something. They need to know that you're right, it is your own. And the problem for me with the Matt stuff is that it's like we're removing. Let me, as the drug addict, right? Let me be the one to choose the thing that I'm going to be dependent upon, right? Let me choose that thing, right? So that I can at least have an opportunity to see a professional tell me, you've been dependent on things your whole life. Do you want to be off this stuff? Or do you want to continue living like this? Let that be the conversation for the doctor, rather than the doctor telling me, because I'm dope sick, saying, hey, you know what? Here's something, take this. It's going to take this away, blah, blah, blah. I'm just saying most providers, Dr. Joe, aren't like you, bro. The conversations don't happen like that. I'm telling you, like a large majority of people going to detox or hospitals or whatever, they're getting slapped this medication.
And they're given such high doses in the beginning,
yes.
regardless of what they came in using. It's
Yeah, they're falling asleep all day, bro. They're in a meeting, fall asleep, and it's not. I really just don't think it's their fault, bro. It's because we that's the problem with Western medicine that I struggle with, specifically, is the MAT programs. It's just like, you gave us something that you're telling us is meant to help us, but you're not giving us a clear way out. There's not a clear exit, especially for methadone.
well, we have to work on that then.
I really, you already are though. I think that you already are. Like, that's why I loved having you on the pod, because I know that providers specifically like you take the time. Like you said, even before I even interviewed him on this podcast, you heard him in the very beginning. He was like, I want to find out where they're at, where they're headed, what's their plan, and then he assists them with what his knowledge is, right? That's most safe, most effective, and long term. That's how it's supposed to be. But I just wanted to vent for a second, because I'm on the pod, I talk about this a lot. So anyways, I think it's just fucked. And I'm super grateful that you're
I think it's fucked too.
yeah.
I think it's fucked.
Now, so
I think we need to train doctors better, and I think
yeah,
we've gotten rid of the whole waiver system where you needed to be trained in Suboxone. Now,
yeah.
I mean,
Yep.
just if you're an addict and you're looking for the right doctor, just ask questions, and trust me, the addict population knows what's going down. And if you're there for the right reasons, you'll ask the right questions, and if you're not, you're not. You'll get hooked up with the doctor that meets your speed.
Yeah, and we had a question from one of our listeners from last week. They were asked the question, "What do I?" And it's okay if you can or can't answer this. I don't know, but they asked the question, "What do I do if I'm in recovery or I'm trying to be clean, sober, but I have significant amount of pain? I have like a lot of pain that ibuprofen or Tylenol can't really address." On my post, I had said, I'm not a medical professional, but I'm a big fan of telling on yourself to providers. Say that I'm a drug addict, I'm an alcoholic, but I am experiencing this pain, right? But to me, it's almost like I wanted to ask you, because I feel like most of the doctors they're going to ask are going to probably, or not most, but a lot of the doctors that they're going to ask might not have that. But since this is your specialty, what would you say? What would you encourage them to do?
I would encourage them to do what I was told, because it served me well. Every doctor that I go see, every dentist that I go see, I tell them of my opiate history. I'm an opiate addict in recovery. And invariably, they will ask me, what do I want? First of all, because I'm a doctor. Don't ask me what I want, because I'm also a drug addict in recovery. Don't ask me what I want. I know that opiates are really shitty painkillers. They're great for 1 or 2 days of acute pain. Beyond that, they lose their effectiveness. You start to develop tachyphylaxis, which is tolerance, and you need higher and higher doses to get the same effect. And then you start getting I can go into the science of it, put everybody to sleep. It's already getting late. Yes, be honest. Be honest, and normie doctors out there. I don't want to I don't want to shit talk other doctors.
You're not shit talking. Yeah.
But doctors can be talked into anything, because they need high turnover. They've got a lot of patients to see, so they're going to be giving out, okay, what do you want? Like, I've seen psychiatrists that give my addict patients that and you ask them after the fact, did you tell them that you were an addict? They're like, I might have left that out. They're getting prescriptions for a benzo and an amphetamine at the same. It's like, what do you do? You just stop that. Give me both of them. Take that. Just have smack it out of their hands. It's like, But it's like you're also have your own. You're in a big boy now. You walk in asking for certain things, and you know a certain doctor is going to give you them. You're going to get them. So, dude, you need to take the responsibility for your actions.
Yeah.
So, if you're honest from Jump Street and you're with the right doctor, and then you've got to have your boundaries. I mean, a doctor may forget about it, or when looking at a real acute pain, I look at acute pain and I go, "What are you taking?" Part of my practice is opiate-free pain relief. Is opiate-free pain treatment. Is pain mechanical or is it functional? And then go from there. And then what studies do we have? Who can I refer you to? You can reach any cavity in the body with a long enough 18-gauge needle and a large syringe, and you can inject whatever you need into that area. And there are non-opioid pain relief measures out there that are stackable, that are
more effective too,
that
right?
are way more effective. Listen, if you're in recovery and you're have a year sober and you go to the dentist and they give you 800 of ibuprofen and it actually does work.
Yeah.
It actually works better than any opiate.
Rotating ibuprofen, Tylenol, right?
Or stacking ibuprofen and Tylenol.
Yeah.
I've gotten euphoria from high dose. Have you? High dose ibuprofen, man. First time I took it after being sober for years, months, years.
Yeah.
I was like, wow, this stuff actually.
Anytime I've ever had any type of mouth thing or surgery, they tell me rotate every 3 hours of this, and it's better than any. I tell people you can go through a lot of painful things in sobriety with directions from a provider, without going to opiates. So I have two last things.
But I'd also want to say that if you're in pain and you need acute pain relief, don't deny the pain injection that you're going to get in the ER. I know you won't. I mean, there are times where I've gone into the ER dripping sweat with pain. Would you like hydrocodone soap? I put it right here. And I know that relationship that I'm going to have with that opiate at that moment is not going to light any fire. There are times when I've had wisdom teeth removed where I've had to give my pills to my wife. And I've been treated with opiates. I've not been 100% chemically sober since I got sober. But what I've put in place to protect myself from lighting a fire or starting to.
Well, people need to know though too. If you have surgery or something serious goes on and you're prescribed an opiate as an addict, like if the doctor says that you're going to be in a lot of pain, I recommend this for 2 days, and then go to ibuprofen Tylenol. Listen to them. Like that's
if
huge.
you're in acute pain after surgery and it's more than 2 or 3 days. In general, again, trust your doctor and the advice he or she is giving you, but there's something else going on. You should explore why you're in pain post-operatively that much to require this many opiates. Now, there are there's a lot of pain states that require a little bit longer, and obviously, but if you're in recovery, you don't have the luxury of going, whatever the doctor told me, I guess I'm just going to, I guess I need a refill. If you're working on a refill of an opiate and you're in recovery, you really got to question that refill.
Yeah, that's a good point. I have two last things to go over real quick before we close. First thing, is there any message that you would like to share with the people who are in the recovery community because this is going to go out to the world? Is there anything specific that you want to share with people from your position of understanding medicine, but also understanding recovery? Is there anything you want to say that's encouraging or something that you've learned in your experience that you want to share that you wish more people knew?
If you don't believe in God, God's all around you. How can you be an atheist in such a beautiful world? Did we lose fucking patience? If we treated our post-recovery, our recovery period like we treated our using period and demanded the results immediately, wouldn't they lose wouldn't we want more and more results and more results? I mean, you can get addicted to results. And also, stop talking and listen. The answer is thrown around. If you're in the right rooms and with the right people and you shut the fuck up for a minute, you'll get the answer because it's flying around the room.
Amazing.
That's
You'll hear this through all of our guests. There's one thing common thread out of everything that's agreed with or disagree with. The one common thread for anyone who's wanting to find out more information about recovery, what that actually looks like, there's a spiritual component. And usually we use the 3-letter word God, which at first I was like, nope, I'm good, right? But I talk about it all the time. I talk it on the podcast. I talk on social media. God in my life brought consistency, brought the best version of me out, right? Making my life more about other people, making my more life about spirituality. And then, like he said, listening, huge part of at least my recovery is my first sponsor said, if you think you're right, you're probably wrong. Or no, he said, if you think you're fucked.
no, that's my sponsor.
No, he said, if you think you're fucked, you're probably right. If you don't think you're fucked, you're super fucked.
You're really fucked.
Yeah. So just take a chill. We accept you here. We love you here. We'll never fucking give up on you here, but you need to sit down and listen. Because these other men in this room or other women in this room have lived, breathed, and seen the things that you have and maybe even more. So listen, so you can find the commonalities rather than the differences. The last thing I want to go over with you is I want to get, because people who have been watching the podcast have seen my journey because the first podcast was with DC. Him and I started this podcast together, and they've seen me evolution-wise in the last, I guess it's been 11 months. Next month will be a year. I want to give an update and also talk to you a little bit about that. And feel free. Dr. Joe also knew my really good friend. He was a very good friend of Dr. Joe. Actually, DC, I think, even brought you up on the podcast. He loved you very much, bro. And he was one of those guys that had really small circle to the people like he really, really raved about. You're one of them, And I want to share that, in the last seven months, the 3 months after, some of the podcasts I don't even remember filming, but I was struggling a lot, and I had talked to some good friends of mine, and Leah, my fiance, had told me, hey, babe, you need to go talk to somebody because you're not all there right now. There was days where I'd get lost driving home. I was disassociating a lot after experiencing that trauma, but I actually reached out to some people. It was not Dr. Joe.
No, but we had lunch that day, and you were telling me about.
I told you
about your dissociation.
Yeah. I spoke to a couple of providers who really took good care of me. They really did. And I wanted to bring this up with you on here because, there's some things outside of recovery, right, that are not really in our scope. I mean, that whole situation and the aftermath and the healing, definitely a lot of it's recovery, and a lot of it's the spiritual practices that I've learned in AA. But there's some things that are out of my control that I needed help with, and I had to humble myself and ask for some help because I was disassociating so much and sleepwalking so much, and it wasn't conscious for me, and I was uncontrollably crying. Like, people would leave the house and I'd just cry for hours. And I couldn't stop crying. And it wasn't like I was sad, but I just couldn't, it was just this mourning that and I've seen a lot of hard things in my life, and I have a lot of trauma in my life. But this particular thing, one of the podcast guests was my good friend, and he literally told me on the podcast, he saw it ruin me because he was close by me. I'm closing with this. Are we still good? I'm closing right now. But I reached out to a provider, a doctor, and he prescribed me 25 milligrams of Prestique, or what's the generic version of that? Not Prestique. Fluoxetine. Fluoxetine?
It's lisdexvenlafaxine.
Is that what it is?
I don't remember the generic.
Well, anyways,
name,
he prescribed me. He's like, I'm going to prescribe you a little bit of this to help to kind of it changed my
Reset.
life. Yeah.
Yeah.
It literally, from that first 3 days of me taking it, it helped me so much because I kept forgetting about my therapy appointments. I'd schedule therapy appointments and I'd miss them. I would go to grab lunch with somebody like you and I would completely miss it. And I would, be doing, my team was amazing. Like all my staff, they were incredible. They took care of everything for me. for a while. But I want to talk about this because I want to share with people that, you know, I have it drilled into me that that 12 steps work in everything. And I do believe that they do to a certain point, but I was going to 5 meetings a week. I was sponsoring like 8 guys at the time. It saved my life, you know, after I found DC like that. I mean, all I knew was to go to a meeting. That's all I knew what to do.
Yeah.
But even after doing that, I was still hurting and struggling. I didn't even know that I was till my loved ones told me. You know, I didn't really know until like Leah was like, babe, I'm worried about you.
Thank God you had the
Exactly.
You didn't have the
And
ego.
you know me.
You didn't have the ego force field to like tell
Well,
them to go.
I kind of
"Don't worry
did
about
for a
that."
moment.
Oh,
I mean,
yeah.
I was like, no, I think I just need to keep doing the EMDR, whatever, and that was it, and it was great. It was effective, but you know, I'm really grateful that I had her in my life, and certain people would be like, yeah, it's time. It's been a few months, and you need to, whatever. And I did, and I'm really grateful I did. They knew I was an addict. They knew that you know, whatever. And he prescribed me this one thing, and it really helped. And supplements, vitamin C, vitamin D3. I'm taking some QH something 9 thing. I'm taking some other thing, and it's really helped me a lot. And working out and being healthier. And man, I'm telling you, I had no idea how hard it was until I was out of it, until I was on the other side. And I look back and I'm like, oh man, I was in the middle of that, and I had no idea how badly hurt I was, you know? So how are you doing post with DC being gone? How has that journey been for you?
DC was a shining light for me. He was always there's like there's a small list of people that are the good guys in my life, that no matter what, DC was always a person who always did the right thing. You know, he wasn't the one person that I interacted with at the treatment center that I directed for him. So he would interject every now and then when there needed to be an emotional input, and he always chose the caring path, no matter what. He always had a sincere interest in people doing better.
Better, yeah.
And not in like a shining knight, I've got to save everybody, like kind of in, we need to save the world and get in, you know, we're going to see whatever. It wasn't like that at all. It was when I found out he passed, it was really, really, really sad. It left a hole. It left a huge hole. I'm not going to say in my life, but he left a huge hole in the community. I was sad to see him go. I mean, I was close with him, but you know, it's not like I invited him to my wedding, and we weren't close like that. But I was close enough to know him well enough that, and you can ask my wife. I still have his memorial picture in kind of like a frame in my office. And it's an inspiration to me to take care of people like he did.
Yeah.
Because I don't even have the same.
No. It's pretty. It was.
You know what I mean?
Yeah, it was pretty incredible, wasn't it?
He was an example to me.
Yeah.
And not that I'm. Oh God, no. I'm not the roadmap
though.
I'm not the ethics roadmap. Trust me. The things that I've done in my life, but. Of all the good people that I know, he's up there.
Yeah.
He's up there.
Well,
he still lives in me.
Yeah.
So,
and he lives through us, and definitely through this podcast. I was going to throw a towel in, and I'm glad I didn't. I've got to have some amazing conversations, and I want to just end with this, everyone. This podcast has always been meant to be, you know, making sure that redemption is always relevant. You know, our stories, like I've shared the stories about people in recovery from all different walks of life. Like we have literally a physician provider here who's also in recovery, right? And then a washed up rock star like me, who's now opening a coffee shop, who's in recovery too, you know? Like all different walks of life, you know? And if you're out there and you've struggled to find that help, you've struggled to find people that you could put that trust in, you just got to keep going, keep reaching out. Like I said, my Instagram is always a place for people. My DMs are always open for my struggling addicts, brothers and sisters. Okay, you reach out to me, I put you in contact with people like Dr. Joe, people, friends of mine, people that I've trusted to help my family and to help me truly. Okay, so if you guys have any questions for further podcasts, maybe you guys really like this podcast with Dr. Joe. Maybe you have certain questions you actually want to hear from him. Maybe not medical professional questions, but maybe something he can answer for you or give you a whatever. Let us know on our Instagram. Let us know on YouTube, and we'll definitely have a follow up with Dr. Joe in the future. And maybe we could bring those questions to you guys. So
that'd be great.
Thank you so much for participating, and Dr. Joe, thank you so much for coming out.
Thanks, man.
Like I said, I'm sorry I didn't have my cards with me, so my ADD definitely came out a little bit, but I had a great time always with you. And thank you for
Likewise.
all that you do for our community, and thank you for being a brother to me. Thank you so much.